Welcome back to Divine-Inspired Care. Glioblastoma is a rapidly growing brain tumor killing half its victims within a year. Experts may have discovered an unlikely treatment for glioblastoma, a little-known antidepressant called vortioxetine. Swiss scientists analyzed the effects of 130 medicines on brain cancer tissue, finding vortioxetine most effective at destroying disease cells. Research on mice with glioblastoma showed the drug slowed tumor growth, especially when combined with chemotherapy. Experts believe the pill is effective because it crosses the blood-brain barrier, bypassing the membrane that stops substances entering the brain. Professor Michael Weller, study co-author, said, "The advantage of vortioxetine is that it is safe and cost-effective. It could soon supplement the standard therapy for this deadly brain tumor." He urged patients not to take vortioxetine without medical supervision. "We don't know if it works in humans or the required dose, which is why clinical trials are necessary," he added. Researchers combined brain cancer tissue from 40 patients with 130 medicines, including Parkinson's drugs. They used scans and computer analyses to assess the medicine's effectiveness in breaking up cancer cells and preventing tumor growth. Vortioxetine quickly triggered reactions passing through the blood-brain barrier. The drug, costing around £40 for 28 tablets, proved to be the most effective antidepressant. 2 further trials are planned to see if it enhances chemotherapy and radiotherapy. Experts say, if effective, vortioxetine will improve glioblastoma treatment. Commenting on the findings, Dr. Simon Newman, Chief Scientific Officer at the Brain Tumor Charity, said, "Any scientific developments that bring us closer to new treatments for glioblastoma are promising, as treatments haven't changed in decades. Using new technologies and repurposing existing drugs may help achieve this. Finding drugs that cross the blood-brain barrier is a challenge, so using drugs that we already know can do this is an exciting prospect. We look forward to following future studies using vortioxetine." Typical treatment plans for the aggressive cancer, which strikes around 3,000 Brits and 12,000 Americans each year, involve surgery, chemo and radiotherapy. Diagnosed patients usually undergo surgery to remove the tumor. This is followed by daily radiation and chemo for around 6 weeks. Radiation can then destroy additional tumor cells. The cancer can double in size in just 7 weeks. Average survival time for glioblastoma is 12 to 18 months, says the Brain Tumor Charity. Only 5% survive 5 years. The disease killed Labour politician Dame Tessa Jowell in 2018, a year after diagnosis. In March 2022, the wanted singer Tom Parker died 18 months after his stage 4 glioblastoma diagnosis. Vortioxetine, also known as Brintellix, is an antidepressant used to treat major depression unresponsive to other treatments. It works like selective serotonin reuptake inhibitors, or SSRIs, but also uses other mechanisms to increase serotonin, the brain hormone responsible for mood. Please get in the comment section and share your thoughts. Don't forget to like, share and subscribe. Until next time, goodbye.